Okay, now we have the hip day. So this is where we're trying to do the MSA type of approach for your hips. Hip is a ball and socket joint, so we really want to try to make sure this thing is moving, because if not, it'll throw off your knees, lower back, mid back, kind of all the above. Okay, so what we're gonna do first is the M, myofascial release. Get out the trusty foam roller. She's gonna sit on it. Whatever leg she has crossed, she's gonna lean to that side, put that pressure on that glute area, and she's just gonna roll up and down it. 10 times for now. Now, as she does better, what I want her to do is think of this as more of a scan. She's scanning that tissue up and down where she finds that little tension spot. Sometimes I'll have people either lean their hips more or less, kind of feel that whole area around. I always tell people, think of this as like you're a kneading pin, you're kind of working out that dough. This is what you're doing, okay? Transition to like the IT band area. So she's gonna roll to her side. She's gonna keep the bottom leg straight. You're gonna start the foam roller at the top of the hip, and you're gonna work all the way. We're gonna hit that whole area. I like to kind of break the leg up into thirds. She's gonna go about a third of the way down and just kind of stop and work that tissue out. Now, she can have her hand on the ground if she likes to control it this way, or she can have her elbow on the ground to kind of take, so if the shoulder hurts a little bit, just to take that tension off. Now, I personally like to kind of roll that full IT band here, and then I tilt the hips forward a little bit to hit more of that lateral quad type area. Kind of roll your foam roll up and down. Keep rolling. Oh, it hurts. So a little tension through there. So you'll find that quite a bit, especially not really the IT band. Your IT band is honestly like a fibrous tissue. It really isn't designed to have tons of tension and beat up on it. So I like to go over just a little bit to make sure there's more blood flow to it. But that front quad, that lateral quad area does. And you will have tons of little knots all around through there. So I always kind of like, for the top part of the hip, I will either go forward, hit more of the quad, or kind of go back to hit more of like the hamstring area. So remember, if you're just hitting one spot on a, your leg is like a little cylinder. If you're only working one spot, that's not going to do you any justice. So we're going to try to hit that whole area as much as we can. What we're doing is we work that top part, that top third. Now she's going to pick herself up, use the hand, kind of scroll it down to the middle part. Now I'm just going to let you know that middle third of this IT band lateral quad is tender on a lot of people. So if you need to, she can use her arms or this top leg to kind of push herself off the ground so there's not so much weight on here. I'm gonna make Haley do a little bit of a hard one. I'm gonna show you the progression. She's going to put both legs on top and now roll up and down. And what it's doing is having all of her body weight literally right there. And it's pretty deep. So she can come out of this position. So now we're gonna transition to that bottom part, that last third where it attaches to the knee. So she's gonna pick herself up, roll it down there, and she's going to work this little area. Now go ahead and let you know, if you have some knee issues, this could be a thing that is really giving you some knee problems. If that knee tension is tight on that IT band lateral quad, sometimes it'll rotate your leg a little funny. Or if you run a lot, and you notice that knee internally rotates a lot, this muscle or this tissue is going to get very tight and stiff as a result from it always internally rotating, because its job is to try to stop internal rotation. Now this is just one piece of the puzzle, because now you need to figure out what is causing that instability, either from the hip or from the foot, causing the knee internal rotation, which is causing the IT band to tighten up at the beginning. So there again, we're going to start kind of pretty much at the top and work all the way down to the knee. Now, at first, I just kind of go up and down, kind of feel the tension. There again, you're just kind of getting some blood flow into that area. Then I want her to think of really taking her time and going slow and finding that knot. So she has one. Now I want her heel to go towards her butt. And she should feel that tension quite a bit as she's rolling on or holding tension on that area. And this one's a big one, because if you're sitting a lot, you'll have all kinds of little knots all around those hip flexor and quad area. Good. So take your time with this one. We're going to work on stretching the same specific move in a second. Transitioning from the quad to now like the inner leg, your groin area, your adductors. So what she's going to do is she's going to move the foam roller now more parallel to her body, maybe at an angle. And what she's going to do is start around her knee. Think of having that body tension right over it, and she's gonna roll from her inside part of the knee up to her groin. Now this one, a lot of people just don't do, honestly, because it looks weird if you're doing it in the gym, but you're missing a whole section of the leg. So remember, we've done the glute, we've done the IT band, we've done the quad. Now we're trying to get that inside leg of your groin muscles. So this is the lower extremity foam roller series for you if your hips are tight, quads are tight, your knees are hurting, you're about to go for a run, for a long walk, you're about to do some squats, lunges, deadlifts, whatever you're gonna do. Do this before you do your movement so your movement is clean, so you don't have any imbalances or tissue issues that could cause injuries. Have fun. Stretching. So now that you've already done the myofascial release, you're digging that tissue, S. So we're gonna try to open up those quads and hip flexors. So you can use a chair, a couch. This is technically called a couch stretch to open up the quads and hip flexors, but we're gonna use this box right here. So Haley's gonna face away from it. She's gonna put her foot on top of the box, and she's gonna let her knee go down to the ground. Now, sometimes if you're a little short, you can let this bad boy slide. That's okay. Now, what she's doing is she wants to stay as tall as she can. Now remember, your hip flexor's job, psoas muscle, first is hip flexion. So we're gonna try to work on hip extension. So we're trying to bring her hip, she had like, I don't know, in her pocket, she's gonna go forward. Now, you saw how she naturally extended her back. That's because job number 2 of your hip flexor is lumbar spine extension. So what are we gonna do? We're gonna call this lumbar spine flexion. So what I want her to do is take off a little bit. She's gonna put her hand right here on her core, and I want her to think of doing like a little crunch. So she's keeping her back tight, do a little crunch. There you go. It should immediately tighten up that hip flexor. Now that her core and her spine is nice and tight, then now she can move forward just a little with the hip flexor. Now, if you ever want to make this harder, which is typically hard already, is she can try to bring this knee closer to wherever her foot is attached to, because then it's going to really stretch the quad quite a bit, but work up to this one. If you want to take tension off of this, then she can move her knee further away and not really focus on the quad stretch as much. So what we're gonna do first is work on hip rotational movements first before we do any type of flexion or extension type movements. So what she's gonna do is she's gonna lay on her back. This is gonna be a 90-90 supine, so laying face up. Her feet are gonna be kind of a little bit outside of her shoulder width, and what she's going to do is try to drop one leg out and bring one leg in. Now you see how this hip came off the ground? I want her to fight to keep this down, so when she rotates, it's not giving her that extra range of motion because she thinks she's got a really good range of motion. She's like this because her hip and back are moving off the ground. So if that happens, you see how her knee is now kind of on the other part of her shoulder. What I want her to do is try to kick this leg out further, so honestly her femur is in line with that shoulder, okay? So she should feel a nice stretch right here. What we're gonna do is add a little bit to this. This is called the sleeper stretch. She's gonna take the other foot and she's gonna put it right here on top of the knee, and she's gonna let the weight of this leg pull down this leg. Now, I like to add a little bit of an extra caveat to this bad boy. She's gonna hold weight here, but I want this leg, the down leg, to try to push it back up, and this one is resisting it. 2 or 3 seconds, and then relax. See if she can go a little bit further. Then push this leg back up again, and then relax. So this is working on that internal rotation movement. So remember on our exam, we were looking at all the internal and external rotations of the hip. This is working external rotation and internal rotation of the hips. It is a traditional pigeon stretch. We're trying to open up that external rotation, that butt glute area. So a lot of ones already done this in like yoga or whatever. This one is gonna be your 90-90 position like we did with the sleeper stretch. Then she's gonna swing that other leg back if she can, and she's going to now sit down into that movement. So here, this is a twofold. This is working hip flexor right through this side, and then it's working the glute piriformis external rotation on the other side. Now, if she wants to add a little bit to it, because sometimes when you do it, sometimes you have some pretty decent mobility in the side you're working on, which is what it's supposed to do, but then you notice your discrepancies or your issues on the other side. I like to add the hip flexion here, or knee flexion, to work on that hip flexor problems you have on this side. But go back to this. I want her to sit deeper into this movement. So everybody has a ground, everybody can get into it. This is our basic one. Now we're gonna show you the progression of it. Next, get a box, a platform, a couch, the back of a couch, a bed, whatever you can get. this is the next thing to get a little bit deeper. So with Haley, this is almost a little bit below her hip height. So it's a little taller than what you would for your couch stretch. She's gonna put her leg up there again. Perfect. You wanna think of, can she keep her ankle and her knee on said platform? So her shin should be firm. If this bad boy is kind of kicking up like this, you might need a little pillow or something right here to support it, because if not, you'll twist the knee. Don't want you coming in with a knee problem trying to fix a hip. So there again, she's going to pretend like she is setting back. Bring your hips back as you go forward. So instead of just leaning over in the lumbar spine, I want her to think of setting back and doing a hip hinge with that hip. A little bit different feeling. You should feel really deep in that butt area. Hamstring. So we work the hip flexor, we work the external rotation. Now can we work the hamstring? We also did another platform just like this. This is like your traditional couch chair type position. We like to have this one done because guess what? You can do this at work. You can just sit here, kick your foot right up on top of it. So go ahead. Good. Now, we're gonna start over because I want you to think of setting up for success. So for this one, I want you to make sure your feet are straight ahead and they're not kind of kicked out a little bit. Feet are here, then now come straight up through there. Now, your hamstring, of course, is attached to the back of the leg and attached to the pelvis. Now, what's gonna happen is when she tries to bring her toe towards her knee, it's gonna tighten up a lot. Then I want her to think of rotating her whole leg just a little bit here. And then the whole thing is, see how she's wanting to move her pelvis this way to take tension off? Guess what? I don't want that tension. I want her to think of this hip is going to her outside pinky toe. Good. To add a little bit extra, she's gonna take her other arm and try to touch her pinky toe. She should feel a lot of that, all the way up from the lateral hamstring up to the butt. Now there again, if you want to add a little bit of extra little nuance to this and make it harder, what she's going to do when she's here, 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 and rotating, I want her to think of pushing hard into that chair and then relax. See if you can go further. Push real hard and then relax. Add a little bit of tension to it. This is going to get you that extra range of motion that you're wanting. Okay, so what we're going to do is put the band around the ankles. Okay, if you need to sit and do it, that's okay. What we're going to do is stand up nice and tall. Move this out of the way. Okay. Shoulder width apart. There again, she's gonna spread out her toes, grip the ground so she makes a nice little arch. She's gonna have a slight bend in the knee, and she's just making sure that this part, she has a little tack right here, she's not getting that tack in her arch, okay? First one she's going to do is have a nice strong core pelvis, the hip isn't moving, and she's gonna bring one of her legs straight out to the side for 10 reps. 1, 2. This foot is trying to really stay engaged and not move. This knee is nice and bent for balance. This hip right here is not kicking out with doing any type of movements, okay? She is nice and strong and balanced. Now we're going to work on going straight back with that movement. There again, if she needs to reassess, grip the ground. Now what she's doing here is she's trying to extend this leg, so she's extending from the hip. Good, go ahead. Good. Now she's straightening the knee at the very end of the movement. Go ahead. She should really feel a contraction in that glute that she has right through here. Now, she has her hands on her stomach because I don't want her to cause her back to extend. We're trying to make sure that lumbar spine is nice and stable when she's doing said movement. Because if her hip flexors are tight and this is a running type movement, leg is on the ground, contacting the ground, this leg is probably your push-off leg with your sprinting or running. If she has hip flexor problems, it's gonna cause the lower back to move and rotate funny, and then you're gonna come into my office after you go for a run, my back is hurt, okay? If you have that problem where you're like every time you're extending and you're moving and your back is arching quite a bit, you can't have that good stability, what can you do to fix it? Find a wall. What you're gonna do is you're gonna push into the wall, but I want you to pretend like you're gonna slide your hands down, like you're crunching your core, and now she's keeping her core nice and tight, so if someone went up and punched her, it's nice and stiff, and then what she's gonna do is do the same movement, but focused right here, and now do the extension of the leg. Go ahead. Perfect. Slower and more controlled. I don't care about how far this leg goes back, as long as this core does not move and that lumbar spine stays strong. Transition the band position from above the ankles to now she's gonna put it directly over her arches. Perfect. Now she's going to stand, and what she's going to do here is she's going to work on her hip flexion type positions. So there again, grip the ground with the foot, engage, nice strong stance. Now bring one knee up, good, back down, nice and slow and controlled, good. Now, see how she's naturally wanting to put one of her arms up? This is supposed to mimic a running type position. So this leg goes up, this hand goes up, the other arm will go back, just like if you're running, okay? Nice, slow, and controlled. I want you to think of how far can that knee go up to the ceiling as you can. Exactly where it's at. We're gonna turn this into an old school basketball type thing. Lateral movements, monster walks, whatever you want to call them. Now, so she's going to take a nice step to the side, but I want her to focus on letting, we have the band right here on her arches, so it's making her arches worse. I want her to really try to engage, keep the big toe down, but engage that foot as much as she can when she's doing this specific movement, okay? Put an easy way to engage the core, the hips, the arch, all the above. So if you're in a small confined area, just take 2 or 3 steps one way, 2 or 3 steps the other way. Take about maybe 10, 15 steps total. You will feel a big time burn in that glute. So this is our overall hip series. Myofascial release, stretching, and activation. This is a great way to help improve that function of the pelvis and whole lower extremity. Lower extremity foam roller series. So there again, if you need to go for a run, you need to do your squats, deadlift, lunges, go ahead and do this stuff beforehand, so that way it helps prevent injuries, it helps your mobility, so you're not adding fitness on top of a dysfunction.